That was really fascinating what he shared with us this morning through that health scare he had last year and his ongoing battle with cancer and how he used technology to sort of capture that experience from his point of view. It was really interesting bringing that practical application of Google Glass, but also talking about how how surgeons are now doing surgery with cameras fixed to their heads and posting those surgeries online for other doctors to learn from. I mean, that was one example of something that may come up in this session. And we have the aspects of mass health and also individual health, and the craze of wearable gadgets, measuring various vital signs of ours. Different mobile systems and apps that are talking about diet, exercise. There's an impact on medication, on surgery, on assistive devices that rely on intelligent systems analyzing data and the human response. I've seen a lot of work working with the Bill and Melinda Gates Foundation on vaccinations and the work that they're doing to combat disease and promote health in the much poorer parts of the world. And the amount of analysis and data that goes into that. So that goes kind of beyond the individual and sort of talking about a more large-scale implementation and analysis of biomedical data that's out there and the metadata that comes with that as well. So that talks about things like disease, and we're facing the spread of disease today, obviously, with things related to Ebola, to the Middle East respiratory syndrome, and other health issues. So with us today and moderating this session is Rami Adwan, the Chief Executive Officer of EHS, Electronic Health Solutions. It's a private nonprofit company that is aiming to transform public sector hospitals and clinics through the deployment of technologically advanced healthcare solutions, including the Electronic Health Records Program, Hakeem. Rami, I'll leave the session in your very capable hands with your speakers.
Thank you. I'll take the stage a little bit here, so maybe I can go around and then I'll pass the mic to everybody. Ladies and gentlemen, thank you very much for attending this session. Obviously, earlier in the day, Ali Al-Faramawi said that one of the toughest sessions is one that comes after lunch, and then he added that it was the one after His Majesty departed because nearly 2/3 of the auditorium left. So I'm not going to add what I'm going to say right now, but I'm very proud to have you all attend this session with our distinguished guest today. I will start the opening line by just saying about some demographic changes that are impacting healthcare in general. And this is not going to be a session where I'm going to discuss the name of a server or a router or any device that will make healthcare better, but just general principles. The world is changing. There are more people. Population is increasing. In Jordan, the annual growth of population is estimated at just under 4%. And in addition to the world growing in terms of number, they are aging. In the West, in Europe specifically, a person in some countries born today is expected to live for about 100 years of age, just about. In Jordan, our life expectancy, if you are born today, is about 74 years of age, as compared to 54 back in the 60s. So that represents a huge change. There are more of us. In addition, illnesses of the modern day are increasing. With the aging population, cancers, Alzheimer's are becoming more common. And in addition to that, there are all that bundle of NCDs related to heart, diabetes, hypertension, making people a lot more needy of healthcare and treatment. As well, governments don't have as much money these days to treat us. So to put all this together, basically there are more of us living longer, and some would argue living like rusty machines, and nobody there to treat us. So what does that mean? Well, against the backdrop of technology, and you've had probably a few sessions where you heard people speak of clouds, big data, mobility, platforms, processing power, analytics, you name it, there is so much at hand and at disposal to help us optimize healthcare using technology. This is the theme. How can we make healthcare better using ICT? And how can we empower the patients to become a lot more capable to handle their own situations and their own cases to the extent possible medically? In order to put all that together, I have with me a very distinguished panel. But before I introduce them, I just would like to shed light on a couple of initiatives that are taking place in Jordan. We are in Jordan, and though this is a regional event, I would like to speak about them. Allow me to be very self-serving and to single out the Hakeem program at the start. The Hakeem program is a program that is run by our nonprofit company, Electronic Health Solutions. Basically started in 2009 with Royal Direction and Royal Initiative. The Hakeem program aims to roll out electronic health records nationally so that each and every citizen in Jordan has an electronic health record available. The benefits of this system is that it will improve the patient safety, the quality of healthcare, it will reduce costs through elimination of duplication, and it will avail a lot of data. A lot of data that will be used in big data. That's the big word that we've been just repeating again and again throughout this theme. So that is about the Hakeem program. The Hakeem program has already started as a pilot in 2009, and by the end of this year, inshallah, early next year, we will be in around 50 sites in the country, bringing a massive transformation to the quality of healthcare in Jordan. By the end of 2015, we aim to be in 100 sites and so on, and the program will continue to roll. The benefits are enormous, and we have already seen an achieved reduction in some cost of medication in certain locations equivalent to 25% as a result of the elimination of duplication, and as we like to call them, the corridor prescriptions. Prescriptions given on the go without any real need for friends and family. So that is about the Hakeem program. And in addition to the Hakeem program, we have had the benefit in Jordan of a very strategic partnership with Cisco. Our friends in Cisco have launched the Jordan Health Initiative that aims to roll out a few telemedicine stations, and I will leave that in a due course for you, Duncan, to elaborate upon, so that they can extend healthcare to locations that are not otherwise covered by traditional health facilities or where distance is a challenge and requires to be overcome. This is the situation in Jordan, and to discuss some of the big concepts that we are going about, the empowerment of patient, the adoption of preventive healthcare, the optimization of resources, I am proud to have with me on the panel as distinguished guests, one of them arriving a little bit late, but this is okay, Mohammed, you're always welcome. We will not be offended or take it personally. Mr. Duncan Mitchel, the Senior Vice President for Cisco, handling the Middle East MENA region, and he is with us today, and he will be giving a little opening speech at the start in which he will present about Cisco's commitment to Jordan and share some of the information about the innovative ideas that they will be bringing to the country. I have Mr. Amer Zriqat, who is the Vice President for altibbi.com. Mr. Amer Zriqat really has a job that has transcended different industries, so he comes with a wealth of experience in dealing with technology and recently dealing specifically with healthcare through the web and patient empowerment. He is a pharmacist by education, and this has been his original career. Mr. Olaf Lockhart, the Managing Director of Elsevier Health Analytics, he comes to us from Germany, and he is leading a massive initiative in Germany where they are working with hospitals there to bring about a series of analytical measurements that will improve the healthcare in Germany, something that we in Jordan would probably benefit from, and I'm sure that we will hear about it in a bit. Dr. Magil Barghouti, our female panelist today, adding some certain level of diversity to this otherwise all-male panel. Maggie is a doctor, and she is the director of the healthcare track within the Jordan Competitiveness Program. This is the U.S. aid initiative for increasing the competitiveness of Jordan, and a track of which is dedicated to healthcare. Mr. Mohammed Al-Khawaja, a friend, he's the CEO of Startups, and he is basically leading this company that has been started within the M2V umbrella, specializing in mobile applications for healthcare. I will not take any further time. Obviously, I've taken a lot already in the introductions. I will give way to Duncan, where you can actually take the floor.
Rami, thank you for those very kind introductions. I learned a long while ago that it isn't the size of the audience, it's the quality of the audience. So I'm delighted to see you all here, and I'm obviously delighted to be part of the panel today on connected healthcare. Almost 20 years ago, Cisco announced a vision. As a company, we wanted to change the way that the world lived, worked, played, and learned. And at the time, that seemed like quite a grand plan. But if I reflect back as a Cisco employee over the last 2 decades, I would suggest that whilst we've not done this on our own by any means, we have been at the very forefront of innovation, bringing together the potent combination of people, talent, and partnerships to bring this vision to life. At a regional level, we are totally committed to country transformation. And we are committed to delivering that transformation through the deployment of life-changing networks, ensuring that we support the creation of environments for safe, healthy, well-educated citizens that can form workforces that are able to be productive and competitive on a global stage. And of course, with a productive and competitive workforce, one is able to drive economic prosperity and in turn improve the standard of living for millions of people. I'm sure you've heard about the next major chapter of the Internet of everything. This connects people, process, data and things together. And of course, this is extremely relevant to connected healthcare. And I'm very proud to say that as a company, we've been supporting Jordan's vision to transform the country's healthcare system for a number of years now. The Jordan Healthcare Initiative that Rami mentioned, or JHI as it's known, is a strategic collaboration between Cisco, our partners, and the Jordanian government to improve the efficiency of and access to quality healthcare services for Jordanian citizens. Some of the benefits that are enabled by the IT solutions that are included in this program are reduced costs, empowered patients, improved communication and follow-up care. And of course, all of this contributes to a much better patient experience. JHI has enabled 4 key projects so far, which leverage Cisco technologies such as telepresence, networking technologies and security solutions. And along with an ecosystem of partners, we are delivering care at a distance. So here are the headline statistics of what we've achieved. And these are at the 31st of October, and they're increasing every day. But I want to get them right, so I'm going to be very specific about them. Firstly, we have 7 hospitals and 2 mobile units, and they're using Cisco collaboration systems to allow patients and doctors to consult across distances of up to 200 kilometers apart. Secondly, the Ministry of Healthcare telemedicine product, 2,666 remote consultations between patients and specialists have so far been completed, and 20% of those were consultations for children. Thirdly, the Jordan Breast Cancer Program Mobile Clinic Project has facilitated 1,785 female screening cases with 7,134 mammography images transferred. And lastly, the Royal Medical Services Clinical Collaboration Project has 8,026 remote image transfers for 5,134 patient clinical cases. I'm sure you'd agree that is not just a pilot. That is a large number of people that have benefited from these programs. So right now we're going to take just a few minutes to watch together a video which explores the next project for JHI, the Radiology Service Exchange. So if I could ask that we roll the video, please.
In Jordan, people in remote and rural areas often can't get the specialized health care they need. The distance may be too far, the travel cost too high, or the coordination too complicated. But the Jordan Healthcare Initiative, a partnership between Cisco and the Jordanian government, is helping doctors and patients overcome these challenges through the power of technology and the Internet of Everything. We are connecting patients, doctors, and specialists, providing secure access to information and images, and improving clinical workflow by connecting medical devices and equipment.
His Majesty King Abdullah II and Cisco Chairman and CEO John Chambers formed a unique partnership. Their vision to connect patients and doctors in different parts of the kingdom, no matter how far apart they may be. In 3 years, nearly 10,000 patients have benefited from the Jordan Healthcare Initiative. One component is a telehealth project that was launched in 2011 and connects specialists in Oman to patients in remote and underserved communities. Using high-definition video, audio and third-party medical devices, specialists consult on cardiology, nephrology and dermatology with patients who are dozens, even hundreds of kilometers away. This solution has enabled over 2,600 remote consultations between patients and specialists, 20% of them for children.
استفدت كثير من هالعيادة، وفرت علي الوقت والجهد، لأنه مش سهل علي أترك أطفالي وممكن أشوف الدكتور أو ما أشوفه، ممكن أسأل فيها الدكتور عن أي سؤال بيخطر في بالي.
Spending this time with his patients using CHP, it opened a new way for me to impact people's life far away from my clinic.
بالإضافة إلى تبادل الخبرة والمشورة بين أصحاب الاختصاص الواحد، وكذلك أسهم في رفع كفاءة ومستوى الرعاية الطبية للمراجعين وللمرضى. ومن الإنجازات الهامة على هذا الصعيد تطبيق نظام أرشفة وتبادل الصور الشعاعية والتعاون الطبي من خلال مستشفى البشير.
In July 2014, the first ever radiology service exchange in the Middle East went live. Using the Cisco Service Exchange platform, providers at 3 Ministry of Health hospitals can store and share radiology images through a picture archiving and communication system. And Cisco collaboration technology enables doctors and specialists to connect and discuss patient cases and study images together as if they were in the same room.
فبالتالي هذا النظام الباكس راح طبعا يخلينا احنا بقسم الاشعه كنا قسم واحد من مكان واحد نتفرج على كل الموداليتيز، على كل الفحوصات اللي موجوده بالقسم، نتفرج على الصور القديمه والصور الحديثه للمريض بحيث انه نحصل عليها بوقت قصير جدا، ونشوف التاريخ المرضي تبع المريض ونستطيع انه نقارن بالقديم والجديد بحيث انه نوصل لاكثر شيء ممكن من تشخيص دقيق للمريض.
بقدر أحكي مع زملائي الاختصاصيين في المستشفيات الأخرى مثل مستشفى البشير ومستشفى الملكة رانيا، أتشاور معهم في تقارير بعض الصور.
A fully wired mobile breast cancer clinic in the northeast of Jordan supports early detection and is helping the kingdom realize its goal of screening all women in Jordan. In just 18 months, the mobile clinic conducted 1,800 patient screenings and transferred over 7,000 images. The second mobile clinic will be launched by the end of 2014 in the south of Jordan, in the Karok area.
اللي لقيته إنه في راحة وفي خصوصية، وبدل ما أنزل على عمان وفر علي جهد ومال، وبرنامج سرطان الثدي الأردني ساعدنا كثير.
أهمية وحدات الماموجرام هي تسهيل وصول الخدمات لجميع السيدات وخاصة في المناطق النائية والأقل حظاً، كما عملنا على تنفيذ مشروع الربط الإلكتروني مع شركة سيسكو للتغلب على نقص الكوادر القادرة على قراءة صور الماموجرام في جميع المحافظات. وأهمية هذه المشروع هو تسهيل وصول النتيجة للسيدات بأسرع وقت ممكن.
And clinicians in different regions are using Cisco telepresence to collaborate on cases, which is improving healthcare access for people across Jordan. The Jordan Healthcare Initiative is an important step toward increasing access to quality healthcare for all the kingdom's citizens.
So I hope that you found that video to be as interesting and uplifting as I did. For me, it's an example of the fact that the power of people, technology and partnerships gives me great hope for the future, that we can work together to solve some of the greatest global challenges. One such challenge is the fact that approximately 3/4 of the world has inadequate access to radiology services. And Jordan has the opportunity to build out world-class radiology services that not only serve the needs of Jordan's own citizens, but also those of other citizens of other countries who could choose to travel to Jordan from their homes where these services simply don't exist. That clearly gives Jordan the opportunity to take an increasingly leading position in international healthcare, whilst at the same time providing an opportunity to further build upon an international $1 billion market of so-called medical tourism. So hopefully you'll agree that during my initial opening thoughts, we've seen the potential to create a growing and sustainable community that could help further diversify the Jordanian economy, meet what I understand to be a personal goal of His Majesty King Abdullah II, and make a huge impact and positive difference for the citizens of Jordan and beyond. And in summary, I'd like to just close with saying that I think it's truly amazing the things that can really happen when you connect the unconnected. Thank you very much, and back to you, Rami.
Thank you, Duncan. I like what I heard, and allow me to start from that point. And on the Cisco point, actually, I remember that a year or so back, I was in California, and that was part of a reverse trade mission. And we visited one of the facilities, and they had one of those nice little pods that more sort of like a space capsule with all sorts of devices for telemedicine. So I would like to start from that entry point and connect with Dr. Maggie. Dr. Maggie, you are responsible for the healthcare stream within the JCP, and one of the main objectives is the promotion of medical tourism, okay? And medical tourism is often considered a great asset for Jordan because of the body of doctors that we have here and the quality of healthcare. But one of the impediments for it is that after the patients come and they operate or they visit the doctors, they have to go back to their countries, and they don't want to come and fly all the way back just for a quick visit. So the pods would come in very handy. So my question is to you actually, Duncan. Would the Jordan Health Initiative consider investment in that sort of device for Jordan, maybe a few across the region, that would actually fall in, and maybe you too can share into the response of that, because that's an enabler for the economic growth of Jordan and the opportunity creation?
Well, I would say whether it's JHI or whether it's some other form of public-private partnership, there is a very good case to say that we should equip many countries in the region with telemedicine facilities, and to then be in a position where we can seek out specialists who could reside in many countries, but hopefully in Jordan, and allow the citizens of the region to consult with a specialist without the need to necessarily travel by actually using a telepresence type solution. So I think it should be done, and I think there are various models that we could use to make that happen.
Thank you. Maggie, any commitment that could be made impromptu from JCP?
I think from USA JCP perspective, we're always looking for, collaboration with stakeholders on, endeavors that would, not just improve the competitiveness of Jordan, but improve health outcomes for Jordanians and for medical, for medical tourists who are seeking treatment in Jordan. I think, always increasing access to care and information and ease of that, the efficiency of the system is always important. I think one of the hurdles or the gaps when patients come here to Jordan from abroad is the misdiagnosis or lack of actual clear or accurate diagnosis from their home country. So they come to Jordan in anticipation that they would spend maybe a month or a couple of weeks on a specific treatment based on the diagnosis they received from their home country. But what ends up happening here is that they end up spending more time for diagnostic time because of the misdiagnosis that they received in their home country. So if the telemedicine can be expanded beyond the 200 kilometer to other countries abroad that access Jordan as a medical tourism hub, it would be very important. It would serve patients abroad a huge advantage, and it would allow the Jordanian healthcare system to actually accommodate more patients, which means we would improve our medical tourism. So of course, as USAID, JCP or Jordan Competitiveness Program, we are committed to, collaborating with stakeholders to actually improve the competitiveness of the medical sector, medical tourism in particular.
I would quickly just add that whilst the pilots and projects that we've operated in Jordan have operated across about 200 kilometers, we regularly use this technology across the whole world. In fact, I regularly spend time from Dubai talking with colleagues in San Jose, which are many, many thousands of kilometers away. So this is a worldwide opportunity.
Perfect. So at least we know that we have one avenue to explore in that field towards improvement of economic opportunity. Maggie, I'm going to stick with you and then I'm going to move to Olaf after you. But basically you are aware of the Hakeem program. You've been exposed to it. You've seen it closely. You have your own experience in that area in the USA. And I would like to know, the big data word that everybody is throwing around. Can you just shed some light on what are the opportunities using big data for Jordan?
Sure. Just to put in context what we mean by big data.
Agreed.
Earlier, Duncan, you spoke of 7,000 diagnosis images for women. What does that mean? The amount of information when we want to digitize the images or the clinical information that's coming. In an average clinic in the U.S. in a year, they produce about 1 billion terabyte of data, which if we were to store these in a filing cabinet, we would need about 2 billion filing cabinets to store such data. So from a healthcare, from a physician and a healthcare provider, I want to always, what do I do with this data? From a hospital perspective, we look at the operational information in a hospital and then the clinical information that we receive from patients. How do we take this information and make better decisions to improve productivity, to improve quality and reduce the cost on the healthcare? Now, in developing country, we have, the VISTA system that Hakeem is adapting. In the U.S., the Veterans Administration uses the VISTA system. It produces a lot of information. But what do we do with this information to improve patients' outcome, to improve efficiency of the system is very important and should be a focus, for ICT to take this information, actually I would say data mining. How do we use this information to actually make good decisions for our hospitals, for our operations? That's one thing. In Jordan here, in the context of Jordan, as we look at improving the healthcare system, improving the efficiency of the system, not just for Jordanian, but also for the MENA region, because many countries surrounding Jordan seek Jordan as a healthcare provider. So we want to know how do we take this information and actually use it to improve our system? How do we improve patient outcome? How do we reduce the cost to continue to provide quality medical care? That's a key thing in Jordan. Yeah. I think one of the focus here is taking solutions and adapting them to Jordan. Yep. So sometimes global solutions may not be adaptable to the Jordan.
Thank you, Maggie. I'm going to stop at this point and I'm going to just go to Olaf for a minute and let me just toss in a few pieces of data. In Jordan, and the theme again is how to optimize healthcare with limited resources. We cannot open hospitals continuously. We cannot invest in increasing the number of doctors. In Jordan, the statistics that I have been looking up say that we have about 18 doctors for 10,000 of population as compared to 29 in the US. Now, that is considerably lesser. I will couple this piece of data with another piece of data. Today, 37% of the population in Jordan is just under 15 years of age, which compares to 19% or 17% in the US or the UK. So we have an avalanche of people flooding into the older ages at some point in the future. We have only about 5% of the population above 65 years of age. For those of us approaching that mark, we don't have to take any toss to figure out who's going to stick there. So I just hope all of us will be there by that time. Anyway, but that means that with that young population growing and only 5%, it means that within 10 years or so, the amount of stress and the pressure on the healthcare system is going to become very big. Currently, within the Hakeem system, we have about 700,000 entries, 700,000 distinct patients. And to put what you have just said about using this data into something effective, I'm going to come to you, Olaf. Olaf, you are leading some initiative by Elsevier in Germany, whereby you are working with the sickness funds, the equivalent of the payers, basically, the insurance and payers, to analyze this data. Can you tell us a little bit about this experience and share with the audience what you are doing exactly, and we'll take it on from there.
Yes, thank you. Great lead. We're collecting more data than we have ever collected before, and there's a cliche around that this will change healthcare. We're not quite there yet, but certainly it will. In Germany, we data mine 6 million patients' data for clinical outcomes to improve care. Yeah? And all the OECD countries have the same problem, actually, as Jordan will be having. Yeah? We will have an older population and will need more efficient healthcare systems. So let me look a little bit at how we train physicians today. Elsevier is the world's largest science, technology, and medicine publisher. We give a physician a textbook. We give physician scientific papers. They train over the course of their lifetime and build in their minds models of patients, predictive models, and so on. That said, they only see relatively few patients over their lifetime, which is why we all go to see a specialist when we have a life-threatening disease. The specialist tends to see more patients, or we go see the professor, who is generally much more experienced. The new paradigm will be to data mine those 6 million or more, 60, 70, 100 million patient lives, and to predict their outcomes. In this setting, the electronic health records, such as EHS is setting up with Hakeem, are absolutely instrumental. They are at the focus of delivering better care to the patient. They coordinate between providers, but also they give information to the physician that the physician may not have had before. They, with predictive modeling, or with gaps in care, or with implemented clinical guidelines, can assist the physician in making the correct diagnosis and making sure that throughout all that care continuum, the patient is being treated optimally. So, and we're not even at the end stage yet, because we haven't included genomic data. We haven't really included the radiology data that you talk about. This is just beginning. And in 20 years, we will look back at this just as we do on cell phones, smartphones today, and we'll wonder how we ever got by without. Yeah? So it is in the making.
I want to stick on that point for a minute, and I want to give a little bit of an example to people in everyday language. While the theme is optimizing and going preventive, I remember one of the examples you mentioned to us about something you're doing is a study about the colorectal cancer, which is one of the worst cancer killers. Basically, if I remember correctly, this is the second highest cause of mortality within the cancer family in Jordan after lung cancer. And if I've got the statistics wrong, then I have forgotten it, so pardon me, and that is fine. But you were saying about some exercise that you were optimizing a model for Germany, whereby you would identify people with the highest risk, and depending on different types of examinations, some are more costly than another, you would be able to recommend to the state or to the hospitals an optimal mix. Could you just elaborate on that a bit?
Well, this is almost a classic in predictive modeling. You cannot treat all patients equally simply because they have different levels of medical risk, but also because none of the healthcare systems, even within Europe, can afford to treat every patient at that super high cost level. So the objective is to do the smart testing to find out which of the patients are at highest risk, and then to have to motivate these patients to have a colorectal diagnosis, coloscopy, yeah, and which is relatively expensive. It's almost prohibitively expensive to do for everyone, but if you have identified the high risks, you can do that and you can prevent a lot of colorectal cancer that way. Yes.
Perfect. While we're talking about predictive and risk profiling, I know guys I've left you out a little bit, but we're going to jump to you with the theme in a minute, but I have a point to mention on big data. Big data is about connecting the dots together and being able to provide intelligent solutions for medical challenges. We spoke about the case in Georgia, I think, where can we go proactive at full force? For example, if a father and mother are diagnosed with diabetes, we would identify their children as being a high-risk diabetic segment and go to them at schools and educate them. Now, some would say that this is a little bit an infringement of privacy of information and the security of information, and some would say that's just a little bit too much of a big brother and not realizable, not achievable, whatever you want to say. But there is clearly an experiment that has been done in that area in the US. Would you like to tell me about that, please? Maggie.
Yes, sure. So in Emory University, there was an initiative that was started in 2009 called the Predictive Health Institute, where the initiative is, in summary, understanding the lifestyle, collecting data from volunteers for a span of 5 years on their exercise pattern, their genome, their family history of disease, to predict the health outcome for certain specific diseases they might experience, or they might specific disease, or lifestyle changes that would prevent them from actually getting a disease or have a better outcome of a treatment. And it's been actually a very, very successful. The amount of data that's being collected from the Predictive Health Institute. They started with 20 volunteers, and now it's expanding about 20,000 of Emory. Emory has about 56,000 employees, so now it's about 20,000 are voluntarily enrolled in the Predictive Health Institute. This would help us actually not just predict health outcomes, but also design what we call evidence-based medicine, which is very important even from government and policy perspective. Is when we if we have a universal health insurance, how governments want to invest in new therapies. If we want to design education programs to educate youth about diabetes risk, or how do we target areas, and even what type of coverage we would want to, as patients or as governments, offer our population. So this is all the information that we collect, or the data we collect, is very valuable, and it will move us toward better outcome for patients, a better quality of life. So
thank you, Maggie. And I think I'm going to just pick that word you mentioned in the nearly last sentence, government policy. Everything we've been discussing right now is government driven. It's about government prioritizing, it's about government setting the policies. So we're talking about mass scale illnesses, cost at the public level, and so on, which leaves an entire void. The patient to be empowered in areas that are not covered within those zones of priority. And in that end, obviously, we need to give the patient more information. Before we entered, I think you were giving an example about how patient education was something you like to use so that you could basically let the doctor know that you want to be listened to. And of wanting to be listened to, I'm going to go to you, Amer, because you are basically now in atibbi.com. Atibbi.com, for those who have not actually tried it, is an Arabic portal for medical content and an interactive podium for doctor-patient interaction, where patients actually provide questions and doctors answer those questions. So, filling the gap. The government is paying attention to something. There is a big niche of patients who want something else, whether that's a language barrier or an actual coverage, scope of coverage barrier. Tell us about what you aim to do.
Thank you, Rami. talking about the healthcare system and in conclusion of the four discussions that we had so far, when we talk about healthcare, we always go to the outcome, which is saving life or improving the quality of life of patients. So we're talking about 10 to 15% of the population that is chronically ill patients. So most of our budget, most of our attention, and most of our initiatives is going or are going to this segment of patients. On the other extreme, we have the healthy motivated, which is 5 to 10% of any population. And this segment of the population is already taking care of their health care because they're healthy motivated, they're aware of the up-to-date in medicine, so they're taken care of. In between the two extremes, we have 70% of the population, and this is what we call the information seeker. And the information seekers, in general, we are talking about a young population. Given the demography in our region, 60% of our population is below the age of 30. I believe we're talking about a young, dynamic, and less sick population. So the objective here is more about seeking information to overcome certain healthcare challenges. So the objective or the outcome that we're seeking here is a prevention rather than treatment, which means that we have a more cost-saving approach rather than moving into the other extreme, which is the saving lives. Talking about this population, we know that in terms of technology, the technology has changed their behavior in terms of internet penetration, smartphone penetration, the social media. So we know that they have special needs. They have different needs from the other type of patients. They are looking for something that is immediate, something that is personalized, something that is interactive, and something that is private. So I believe the needs of the 70% of the population, the current healthcare ecosystem, unfortunately, does not fulfill their requirements or their need. We're talking about a healthcare ecosystem that is totally fragmented, where you have the healthcare givers, the payers, the pharma or healthcare sciences, and the insurance company, totally fragmented, and there is nothing to connect them together. So today, the objective is how can we serve people, offer them something that is immediate, that is personalized, that is interactive, and that is private. I believe today where At-Tibbi is adding value to patients and to people through their interaction with their doctors. And question and answer, I believe, is the right platform that really can help patients have immediate, personalized, interactive, and this is what really can make a big difference.
Out of curiosity, what is the biggest area of question and answer that you keep getting?
Talking about the MENA region, I would say, okay, 40%.
Never mind, you don't have to answer this. I think we all figured out the question.
I think the government strategies, the main focus is diabetes, obesity, cancer, infectious diseases. But if we look at the actual needs of our users, or most of the people, it's the sexual health. 40% of the questions that we receive are sexual health related. So I believe this is a taboo that most of the people, when it comes to face-to-face or in a clinic setup, they don't have the courage
the nerve
to discuss.
To actually disclose everything in front of doctors. Yes, the social taboos, my friend. But I'm going to jump from you on the note of social taboos to tools that can break the social taboos or at least empower them in privacy. Mohammed, you have been building applications for mobile devices that aim to empower the patient. Is that working?
Yeah, it's working.
This is working. Okay. So basically, Amr is saying we are giving a platform for patient-doctor interaction, which in essence is giving the patient control of the process, rather than just to see a doctor and within a minute tell him, you know, an aspirin, an antibiotic, and so on. Tell us a little bit about what sort of niche you are filling, and how did you find the responsiveness to the applications you're doing? Obviously, there are a lot on the internet. Measure your heart rate, your hearing, your whatever it is. Tell us about your own experience in that area.
Well, basically, the biggest challenge, I think, as we go over time is to provide a healthy lifestyle for people. Because simply this will be a way to reduce the pressure on all the existing, I mean, hospitals, healthcare systems, everything. So driving a healthy lifestyle is something really of value to any nation all over the world. I think we've gone through several experiments at startups regarding healthcare. One of which was a very exciting experiment to me personally, even it was the simplest one. But I mean, I would love to ask the audience, how many of you have tried something called the diabetes risk test by raise of hands? Okay, I see
about 3 or 4 people.
4 people out of maybe
About
60.
4 more who don't want to raise their hands, but they have used it.
I mean, how many people do know what is the diabetes risk test by raise of hands? Okay, so simply it's a test that tells you how tendency or how risky your case to really become a diabetic, especially type 2 diabetes. So the fun part of the story is basically we've developed a simple app that really asks several key questions to people as an interactive way, and then at the end, this app tells people who really respond to these questions how much risk they have to become a diabetic people. And the funny side of the story, I mean, I can say the most important side of the story is that most of them were, like over 70% were having high risk, but they didn't know that they have high risk. So imagine at the end then the app gives you 2 important action points where basically you either book an appointment for a blood test so that you have a clear, perspective of how risky you are, and maybe start monitoring yourself. And the other way is to join a mailing list that really gives you regular information about diabetes and how to really prevent yourself from that. This was a simple experiment that was supported by the Ministry of Health in Saudi Arabia and GCC country. And like I can tell you, towards the end of this year, we'll have 500,000 people just applied this test over this simple application, and in 2 languages, Arabic and English, over this MENA region. So this just tells us a little story about how much people are really unaware and how much really their awareness would really help them become like healthy people, and how that basically maybe reduce the bell on the governments and everybody to really like go through this cycle of treatment. And I really like the way that, At-Tibbi is playing this exciting role for people to really be self-educated about their case before they go into, I can say, the diagnostic and treatment phase, which is definitely painful and costly and all that side of the story. This is one experiment I want to highlight. Another experiment we went through is basically consider that the phone, we call it the one gadget theory, is basically have so much of sensors and measurements that we can collect out of it that really can give you a lot of exciting information about your health status and keep you aware of where do you stand today and how you can make sure you're really aware of your health situation without really getting a lot of gadgets. Even I'm personally a gadget freak, but I see like the phone itself has become the one and only gadget maybe that you need to have with you to keep collecting and getting and storing and maybe reviewing your health information, maybe through even connecting to other systems that already existing or gadgets. But maybe eventually it becomes the one gadget that you need to keep an eye on.
Mohammed, I'm going to actually take it on from here, and because I'm just mindful of the time, although we started about a few minutes later, but we just hope not to spill over the next session here. I would like to just hear some sort of view about tying the mobility, the patient empowerment with the telemedicine. What is the barrier today of making telemedicine a household application so that basically you have that network of doctors, they are connected through telemedicine at homes? Is it the technology, is it the culture and the adoption or the open-mindedness to having this in, or what? And this is a question open to any of you to basically answer. Duncan, go ahead.
I'll start by saying it's not the availability of technology. It may be the deployment and usage of technology, but for most people in most parts of the world, internet is available and various video systems to be used on smartphones, tablets, or laptops, or even desktops are available. But to be fair, if you're going to have a quality experience on a consultation, you would want that broadband to be of high quality.
Okay. Well, I think in a good amount of areas in Amman we do have high quality, and I think in the Gulf probably they do that the step. So that I'm going to actually just give way for the audience if anybody has any question before we move to closing remarks. Does anybody have any question? I think we need to have a mic circulating around so I can volunteer yours. Shukran Alia. To the gentleman there, the gentleman in brown, if you may introduce yourself and your question. Take a couple of questions.
I'm Ayman Mansour from Tafila Technical University. I'm specialized in intelligent systems. So my question, you are talking about big data. Now, is it available for us as a researcher? Can we cooperate to get such data? We have, let's say, plenty of researchers. We are looking for such data. We contact the hospitals. We are trying to contact some physicians, but we reach a stage that it is forbidden. Sometimes we cannot release such information. So how can we cooperate in such?
Who do you direct this question to? I mean, me as Hakeem or anybody here? Or?
Let's direct it to you. As
Okay.
Hakeem.
In terms of Hakeem, as I mentioned, we have about 700,000 patients registered on the system. So this is a lot of data with their interactions and medications. Currently, I think we have a little sort of lack of clear definition of who owns this data. But we operate on behalf of the Ministry of Health so far, so we don't own this data. The intention of the Hakeem program is to avail this data for researchers. It is now that we have just started the program to define the controls for how to release this information within protection of privacy for patients and so on. So depersonalized and more like demographic and medical in isolation of data that can be used to trace patients. We are currently working on a platform for this. The tool that will make it available for people, and the controls and the permissions needed in order to avail it to people. So we are currently working on it. I don't have the answer to you. We will probably feel a lot more comfortable at this stage saying that the Minister of Health, for example, or a certain research institute, but we are in the process of defining that. Yeah. So the intention is, yes, it should become available. That's one of the key pillars of the objectives of Hakeem.
We don't want to wait certain time at the same, because we can detect some of the health problems. We can save, for example, health of people. If we focus in certain research that will help the patient themselves.
We would be very happy to explore any request and assess it when it comes to us. If you have any need, and until such a framework is developed, we will be very happy to deal with requests on case-by-case basis.
The last question, is it difficult to convince health provider to use such programs? Because sometimes maybe you have some clinics or small clinics, not necessarily hospitals. So is it difficult to convince them to use such a program? For example, you go to certain clinic that belong to for Ministry of Health. They wrote, for example, the lab results on certain sheets, and they have big books full of data. Even they have the program. So sometimes they do not use, for example, Hakeem program, or let's say I'm visiting a physician. He will give you the prescription. He will evaluate your cares, but he will not use the program. He will not input the data into the program.
I think the question is clear, and the answer to this is a good practice is a good practice. If they are not writing it on paper, then the likelihood is they will find resistance to write it electronically. That is just a general comment. Electronic recording of data is a tool. Instead of a pencil, they are entering it electronically. We have not found a lot of resistance for the use of technology in general. There are the cases where some people were slightly older in age, less adaptable to technology, but that is a natural barrier that people were willing to overcome as a trend in general. The challenge of adoption is a global challenge. It's not a Jordanian challenge. People, wherever you go in the world, they would just like to scribble and, off you go, and that's it. So there is a lot of education, there is a lot of change management, and what we have found is that there is a good amount of diversity and acceptance, but in general there is a good amount of acceptance. Does anybody wish to add? Please go ahead.
I'd like to, comment and hopefully answer your question from a, physician perspective. So I think, yes, maybe we, as physicians, we're reluctant to, to use that, data because it takes away from the human element of interaction between, from, patient to doctor. But as and I'm talking about the experience in the US, as this evolved and developed into electronic patient records and hospital management systems, there is a huge value in that doctors realize about, having such information available to them to understand, the treatment they want to prescribe. So in the US, we are moving toward evidence-based medicine. So which is, designing, treatment based on, patients' outcome and symptoms or even side effects that they experience. So this information is not easily, presented when you have a hard copy, but in a soft copy when you can actually collect it, and not from one patient, but multiple patients throughout the years. I think for, the challenge here in Jordan that I see is not, would doctors adapt? It's we have to bring the awareness about the importance of the data and how we can use it. So the value of it, and then maybe put the dollar sign on it. So, now the question is who owns that data? I can sell it. I can use it for my benefit. I can use it for innovation. I can use it for improving outcome of patients. I can use it. So from a healthcare provider, I really, knowledge is powerful. And we need to, bring that awareness to providers, to, to many aspects, throughout the healthcare system. So I mean, it probably took so long. Yes.
Duncan, I saw you holding the mic. Did you want to comment?
Yeah, just
and very briefly, please.
Very briefly.
Go ahead.
Not as a healthcare professional, but as a patient. The technology is there to follow me anywhere in the world. The regulatory environments need to be defined, particularly around sovereignty of data, confidentiality of data. But I spend 3 weeks out of 4 traveling through 84 countries. I would hate to get sick in a far-off distant land to be told that the doctor that was consulting for me was unable to access my history. So my dream for the future is that we use the technology, we create the regulatory environments, I give my permission, and that the doctor that is treating me has my history and the up-to-date information from my regular physician.
Perfect. We're going to take 2 questions. We've got one here, then one there, and then we'll come back to you. Doha, please.
Hakeem, Rami, I was really dying to ask you this question about...
No, you don't have to die, just ask
it. It's we're in the medical area here. If I look back at the history of the medical services in Jordan, as it started in the high time in the 70s, where the sort of military institutes and medical services were ahead of everybody else. And then we had the first 10, 15 public hospitals at its best time in the 70s. And then we all know what happened between 88 and 98, where we had this sort of something went down the drain in the public health services. And in that area, in that period of time, we had a flourishing private sector medical services in the form of highly advanced Jordanian insurance companies who actually filled the gap and provided medical insurance for the widest population in Jordan to the best prices and best policies ever. And the reason why I'm asking this question is because we provide software for such insurance companies. Some of them actually own data for or serve as many as 24,000 medically insured Jordanians or individuals. My question to Hakeem is, how do we tap into that sort of wealth of data, archiving, the document management system that they have, all the wealth of health and medical knowledge that they have developed throughout the years. Some of them have actually evolved into a pan-Arab sort of expansion arrangements where you have pan-Arab health insurances, where the policies and the data are transferring across the borders from one country to another. So there's an area here that we can tap. And what I think is lacking, or many can do about it, is that how to sort of connect all stakeholders in that cycle. Thank you.
Okay, I apologize if the questions are coming to me, so I will try to sort of send them that way, but specifically to the point that you have asked. Just a little bit of a statistic, and it's a rough figure. About 50% of the population are covered by the public sector, whether that's Ministry of Health, Royal Medical Services, and so on. And if I remember correctly, around 20 to 30% are covered by private health insurances, and the rest are not covered by any form of insurance, and some of them end up being cash payers, or they receive coverage later on through some umbrella, possibly the Royal Court, financial assistance for medical services. The scope of the Hakeem program is strictly at this point to the public sector facilities. And as we roll gradually, we will be able to cover more facilities and hence have a more comprehensive view of the data across the country. We have a private arm that is for profit, that is basically trying to send the message to the private sector so that we fill the gap for the 20 to 30% who would later on complete the picture of the national data. Okay? This is in the works. What we have found is that the public sector is actually leading in acceptance of the technology more than the private sector up to this point. How can you tap into this information? As we started implementing the system, what we have figured is that a lot of the users who need to tap into this data are not actually very technology savvy. So we have set a program in place where we are designing an entire reporting and data extraction tool. If our friends from the top can just shut the door for a minute, tap into, create a reporting and data extraction tool that is more everyday person usable. This data will become easily retractable, whether by a person working in the public sector healthcare and who is with the designated authorities, or whether a third party who is seeking to receive this information. As I said, as we are developing it, we have a challenge of defining the rules and regulations that permit any authority to get that data. We as Hakeem program are custodians of it. Our mission is to make this data usable for decision making and policy setting and healthcare improvement, and whatever other economic empowerment in the country. But this is currently under process, and we deal with any request on one-to-one basis. So the vision is there. I hope that we are not talking about long-term. By mid Q3 2015, this should all be done and covered. This is our target, so it's not really very futuristic and very far away. I am going to move to the lady in white, and well, okay, fair enough. So. And I really would love if you can try to direct your questions to one of our panelists, and then if it is to me, I will answer it.
Hi, my name is Farah Nabilsi, and I'm a lawyer here, so I couldn't stop myself from thinking from a legal perspective.
Do we need to sign anything or disclaimers before answering anything?
So as we all know, and this is not a question, it's just an addition and a comment to this brilliant conversation. Like, Jordan is not lacking any brilliant technicians or people who will actually develop a software and provide a platform. But the problem is, in order to get investors interested in this particular program, or in order to basically support you more, we really need to have a good regulatory system that basically because for now we don't have a data privacy law that is regulating what happens with the data.
There's something, the Data Protection Act is actually currently in the works.
Yeah, how to process it, how to exchange it, how to take it outside of the country. So this is a main element that, and if you're saying that the public practice or the public sector is actually supporting this idea, then I think it's like the Ministry of Health is the best person to actually start putting a draft into place. I know there's several drafts happening, but we need a support in order to regulate that area. Because with no laws, no investor is going to be interested in putting all that money when they don't know that the data is actually for them to use and to invest further.
I'm going to take a step to Olaf. Olaf, you are handling this, and I know that the word security, privacy of data has arisen a lot of times in our conversations. What is happening in Germany on that end?
Is it on?
No, it's not. I'm going to give you mine for a minute.
Muted. There we go. Try again. Okay. So clearly we're all patients, or we're going to be all patients, all of us here, and no one of us wants to see their personal information on the web. Yeah? So that is a given. Within that given, there are data frameworks throughout Europe that range from the very lightweight, say in Denmark, to the almost prohibitive in Germany. Yeah? I'll give the two examples. Denmark has an electronic health record system. All physicians can access that with their PIN code and are identified and logged. The control is that the patient can see every physician and provider that has accessed their data. And in a country of about 6 million patients, less than 5 data breaches happen every year and are prosecuted heavily. Has advantages. All physicians can see what predecessors have prescribed, whether a patient is at risk. The patient calls them at home, they can access the files. Has a huge advantage for the healthcare system. Yeah? The Danes, after quite some public discussion, now feel very comfortable as a nation, as a political group about that. My home country, Germany, is on the prohibitive end of this. Yeah? The sickness funds collect all the data. We data mine the data. We can see where a patient is at extremely high risk of polypharmacy, i.e. 2 different physicians have prescribed medications that are not at all compatible and that the patient is likely to end in the hospital. And what then happens is a lengthy process. The health insurance has to write the physician for their consent. The patient gives consent in writing, and only after that very lengthy process can the health insurance alert the physician to that risk. I find that on the somewhat more prohibitive end. Yeah? Every nation needs to figure it out for themselves. What needs to happen is also a discussion on the benefits and not just on the risks. It's very important for patients to understand whether the system is benefiting them, is taking care of them, or whether someone is simply accessing their personal information, which is a no-go, clearly.
Thank you, Olaf. Duncan, briefly, before we move to...
I'd like to briefly just say I think that the patients should have some say in that. So there could perhaps be some sort of system where the patient has an opt-in to various levels of disclosure, as opposed to a state or multiple states taking that decision on their behalf.
The eternal question, democracy, empowerment of the individual, or just deciding for them. The lady in white, please.
Okay, my name is Rebecca Alcobaisi.
If you could speak up.
Rebecca Alcobaisi, representing OESD. My main thing is, I'm going to add to all of what you said, it's identity management, which means as such, as Duncan said, if he's on the other end of the world, that they have an identity from Duncan, knowing exactly what they can get from his health record. As Olaf said, in Denmark, using the identity management, you can get all access to all of the previous things in the health system. Or as, I've forgotten your name, sorry, Ahmed, said, why don't the health insurance or wherever get together somewhere to solve the identity management of the data for the health system?
Who would like to take that or comment on it?
Maybe a comment from me then. It is relatively easy within the European countries or those countries with a national health care system. You typically get a personal health care number. and we get into the typical early stage problems of what do we do with the data if your citizens go abroad. In the US, a much more difficult problem with many insurers and electronic health records just now emerging. I think it is a visionary step to say that we will be able to exchange data and have individual protection. It's visionary. You would need a worldwide access code for this.
Makes perfect sense. Maggie and gentlemen, I have been courteously asked by Alia to actually conclude the session. And as such, I would like just to leave it for one final comment before we do that to the gentlemen related to the patient empowerment who have been the least involved in this debate today. Amr or Muhammad, would you like to have a closing word about economic empowerment?
Definitely.
Using technology, please.
I think it's time to move from a volume-based healthcare into a more value-add healthcare. And this cannot happen without empowering patients. And empowering patients is about fulfilling their needs. Their needs, it has to be immediate, personalized healthcare. It has to be interactive, and it has to be private. Without offering mobile platform to interact, communicate, and connect with patients, without offering the web-based content to educate patients, without empowering them by offering them also the ability to have the powers, I think the healthcare system or the healthcare management system will not be a sustainable one. So this is the starting point to have really an efficient and sustainable healthcare ecosystem. Without innovation, pushing innovation to be the core of this healthcare and the ecosystem, and connecting all the stakeholders and the players together in order to generate a more structured big data, more relevant big data that will help everyone to generate and make the right decisions. So I would strongly recommend that it all starts from the patient level, that you need to empower them to make sure that you have a more structured and more relevant big data.
Thank you very much. Gentlemen, ladies and gentlemen, you have been a fantastic audience. Thank you very much. Please put a hand for our panelists. Thank you, Duncan, Amir, Olaf, Maggie, and Mohammed.
Thank you, gentlemen, and Dr. Maggie. We're going to move on now to our final discussion of the day. It's on financing innovation, defining the options. Just awaiting for our moderator and our speakers.